Unfortunately, here in Tennessee, we do have the highest maternal mortality rate in the country. Amid high maternal mortality rates, Tennessee has stopped releasing the reports, and health officials won't say why. Maternal mortality rates in Tennessee include 41.1 deaths per 100,000 women that deliver a baby, twice as high as the national average. There were 166 maternal deaths between 2018 and 2022. And I want you to stop for a moment and think about that. That's 166 families that took a baby home without a mother, had a funeral, and had to figure out how to raise that baby alone. Over 90% of the deaths were deemed preventable. The leading cause of pregnancy-related deaths in Tennessee were mental health conditions. These include substance use abuse and other, such as depression and anxiety, cardiovascular conditions. This includes cardiomyopathy, which is a condition where the heart enlarges and does no longer work properly, preeclampsia and eclampsia, which affects many women, and infection. Factors that play a role in this: 18.4% of women in Tennessee receive inadequate prenatal care. In 2022, we ranked 45th in mental health access. Discrimination contributed to 33% of pregnancy-related deaths. Black women die at 3 times the rate of white women in Tennessee. There are maternity care deserts, and they continue to get worse. We are seeing our rural hospitals close, and this affects the people in those communities the most. Any county without a hospital or a birth center or OBs, doctors, is considered a maternity care desert. In Tennessee, 32.6 of our counties are described as such. 34 of our 95 counties have no birthing centers. 27% of women in Tennessee have no birthing hospital within 30 minutes of their home. The lack of prenatal care results in 5 times the risk of death from pregnancy. 9 rural hospitals in Tennessee are at critical risk of closure because of recent cuts to Medicaid and Medicare. So you can see by this map where we are lacking hospitals, and it includes most of Tennessee. You see that our urban centers are able to serve the community, but we're bringing in all those people from those outer communities to get care. What is the state of Tennessee doing to prevent these deaths? Trying to do community outreach and education like this, raising awareness. Tennessee House Bill 572 requires hospitals and birthing centers to provide information about post-birth warning signs. And these can include anything from bleeding, elevated blood pressure, or postpartum depression and anxiety. Senate Bill 44 asks that 10 care coverage covered for doula services. This did stall out in the last session, but there's needing to be more and more of a collection of data that supports that doulas can improve maternal outcomes. This is an example of the piece of literature that they get to take home with them, and offers them a QR code so that they can seek help. I think it's pretty inclusive and helps people to know when to reach out for help. With maternal mortality and morbidity, we have also seen an increased risk of preterm births in Tennessee. It's at 11.3% in 2023, and the March of Dimes gave our rating a D-. Infant mortality is described as the death of an infant within the first year of life. 6.61 infant deaths per 1,000 live births. There were 544 infant deaths in 2022.
I don't space. Yeah, well, I'm too short for this, so I'm gonna try something different. I'm way too short.
Well,
Hi. Hi. back to infant mortality for one quick second. I actually sit on another thing. I sit on the Child Death Review Committee for Davidson County, just because that's where my hospital is. Which means we review, so the way that we come up with like, what's the maternal mortality rate is every death of someone in pregnancy during like childbirth or in the, I believe it's 1 year postpartum, is reviewed by a committee of experts. So I do that for infants and children in Davidson County, and there's someone for each county, there's a group for each county, not just one, a whole group that does that. So we just happen to have just started in 2025, and of the first 3 child deaths or infant deaths in Davidson County, 2 of those were from multiple fetal anomalies, abnormalities that were not consistent with life. So then I'm gonna use that as my segue. The Human Life Protection Act, which went into place, it's a trigger ban that went into place when the Dobbs decision happened in reverse Roe v. Wade in June of 2022. Oh, I love you. Thanks, dude. Hey, so it made a complete ban on all abortion care beginning at fertilization in the state of Tennessee, went into effect June of 2022, which, by the way, was exactly the month that I became the physician chief of women's services for a hospital system that I am not representing here. So I was basically supposed to take care of all the OBGYNs and all the pregnant women and everybody in that hospital system, whatever it might be, which is pretty big and delivers the most babies of anybody in Middle Tennessee, sorry. And it made any kind of abortion care a Class C felony. What's a Class C felony? It sucks. It was 15 years in prison and a major fine, something, I forget, 15,000, some horrible thing. So there was the only exception in this particular bill was for the maternal life or, quote, irreversible loss of bodily function. There's no definition. I don't have a definition for that. If somebody has it, please call me. So there were no exceptions for rape, incest, or for minors. There were no exceptions for ectopic pregnancies, and ectopic pregnancy is a pregnancy that occurs outside the uterus, like in the fallopian tube, which is not survivable by either the embryo or the woman carrying it if it's not treated. There are no exceptions for molar pregnancy, which isn't a pregnancy, it's a messed up placenta that can become cancer. It's not a fetus. Those 2 things later were added by our state legislators because they figured out that they made a mistake. There still are no exceptions for lethal fetal anomalies. Once again, we came closer, not close, closer to getting that this last legislative session. We are not gonna get it this next legislative session. So those 2 mortalities I just mentioned in Davidson County could have been people who could have terminated early when they discovered that they were carrying fetuses or embryos that couldn't survive, but they couldn't. In the state of Tennessee, they would have had to leave Tennessee to do that. And they might choose not to, and that is fine, but it should be their choice, not our state legislators. Because they had to hold their babies as they died in the hospital. And what if one of them, the mother, developed some kind of complication of pregnancy that was lethal? There's your maternal mortality rate. Okay, and no exceptions for psychiatric indications such as suicidal thoughts, such as drug abuse, and these are things that are causing maternal mortality in our state. So what were the effects of the Human Life Protection Act? I'm supposed to, I have notes, I forget to look at them. Delays in treatment for pregnancy emergencies. I always like to cite, this was again when I was physician chief of women's services, there was a patient at one of our hospitals who, she was like 17 weeks, 18 weeks, not survivable outside the uterus. Her water had broken. The fetus's legs were in her vagina, and the top of the body was inside her uterus still. She was partially dilated, but not enough for the whole thing to pass. This is not survivable. This is going to cause an infection for the mom. This is going to cause death of this embryo. But she had to sit there in the hospital with this circumstance while this doctor called me and said, what can I do? I called my hospital administrators, legal, blah, blah, blah. We had already had the whole conversation, so I knew their answer, but I had to confirm with them. And I got permission to terminate that pregnancy, even though that was a Class C felony for that doctor. And she told me she couldn't do it because she was the sole support for her family. She has small children and she has student loans to pay. She couldn't afford to lose her license. If you commit a felony or get charged with a felony, you can lose your license. You can't practice, you definitely lose your privileges to the hospitals. So you can't practice medicine. So she didn't. She waited till the next day when a more senior doctor came who wasn't afraid for her life or career. And she gave the patient one dose of one medication and the embryo passed. And it was tragic and it was sad, don't get me wrong, but it was also tragic and sad that woman had to sit there all night with that embryo in her vagina and stuff. Okay, I'm sorry, I'm getting carried away. So difficulty obtaining medications for other medical problems. For example, I always get this one wrong, so I always have to look. Methotrexate is used for lupus and rheumatoid arthritis. Those are really bad. Somebody in this room must have one of those. Those are bad illnesses. Methotrexate, thank you. I got a nod. We're just going to leave it at that. Those are really bad illnesses, and that's a really important medication. It's hard to get now because it's also used to terminate an ectopic pregnancy, which, by the way, is legal. Delays in cancer treatment. Oh, I did have, again, when I was visiting Human Services, one of our blood cancer doctors had a patient who was pregnant, newly diagnosed with leukemia of some ilk that I can't remember, and the chemotherapy she needed would cause her to miscarry likely. And he said he would not give her that medicine because he did not want to be charged with performing an abortion in the state of Tennessee because he didn't want to lose his license. So he said, well, someone has to terminate this pregnancy, and nobody was going to do that because they didn't want to lose their license. So her only choice was to leave the state, get that pregnancy terminated so she could get her cancer treatment. Continuation of non-viable pregnancy. I gave you a couple examples of that already in Davidson County, and I'm sure that happens in other counties as well. So we have had some changes. I'm not being so negative, sorry about that. So House Bill 883, which was signed by Governor Lee in April of 23, that one added back some narrow exceptions, including what I've already mentioned, the tubal pregnancy, topic pregnancies, and molar pregnancies. It gives the exception for life or health of the mother, once again vague. How close does the health and life of the mother have to be before we treat? The patient who was in our hospital bleeding from a placenta previa, ruptured membranes. Previa, the placenta is covering the cervix, so as you dilate, it bleeds, and it bleeds. Will bleed with the blood flow to the uterus. It's pretty impressive. And she was bleeding, and we were giving her blood transfusion. And again, she was super early in her pregnancy, a couple of months from viability. Is that close enough? It doesn't say it in this bill. So we have reasonable judgment. We're allowed to use our reasonable judgment now. But somebody else can say, well, that's not reasonable, your reasonable judgment. That's a problem. Senate Bill 1004, more exceptions for inevitable. Oh, this is the most recent one. This was in response to a lawsuit that was brought by the Center for Reproductive Rights against the state of Tennessee and made a couple of exceptions, including an inevitable abortion. How inevitable? I don't know. It put in the verbiage substantial and irreversible harm or impairment to basic bodily function. How irreversible? How substantial? What's substantial? Define it. And it excluded, again, mental health issues, which we know is the #1 cause of maternal mortality in the state of Tennessee. I should just be using my notes, but I never remember to do that. Unintended consequences. If you have no exceptions for fetal anomalies, you're gonna have more babies born with significant birth defects, which means you're gonna have a higher infant mortality rate. People are gonna be hesitant to become pregnant, and if you think that's not true, we are doing so many more salvagectomies, tubal ligations than we ever did. People are seeking more forms of birth control. I promise this is true. I see this every day. And this is very true, that abortions are happening later in pregnancy because access to care, people have to leave the state. When you have later abortions, you have more risks to the woman's life and health and fertility. If you want to keep someone for their next pregnancy, they terminate a pregnancy with birth defects, don't wait till later because you're risking their ability to do that in the future. More people look for permanent sterilization, super true. Ultimately, and I'm not gonna get into this, theoretically increased risk of poverty and crime rates. I'm gonna let that one alone. So, what is a miscarriage? You guys know what a miscarriage is, right? Do you know what the rate of miscarriage? Who knows what the rate of miscarriage is? Anybody want to throw that out? It's one. Someone said something. It's you tell me if I'm quoting you what you say. 1 in 4 to 1 in 5 pregnancies. 1 in 4 to 5 pregnancies. That's normal. And I tell patients that all the time because I diagnose miscarriages all the time in my ER, and nobody knows that because they don't think about it. But a miscarriage is a spontaneous abortion. That's what we call it. So abortion care is miscarriage care. It's normal. I do it every day. But we are being limited. Oh, there I said it. But we are being limited in our ability to care for these patients because of these laws in the state of Tennessee. We're having delayed treatment. We're having difficulty accessing the medications that we need. There's two of you guys have heard about the medications. You can only get mifepristone in certain hospitals. Can you get it in your hospital? I get it in my hospital. So I have patients coming from doctors' offices all over the place to my ER to get the medicine to treat a miscarriage. Something that happens in 1 in 4 to 5 pregnancies. Without that medicine, we're gonna have more D&Cs, which is surgical procedure, which is an unnecessary procedure when you could have used a medication. The number of people who are applying for OB/GYN residencies in the UT system, which I work with closely, decreased by 35%. And I promise, this is just an aside, I might be on the slide, I don't remember. There are so many OB/GYNs retiring. Whose OB/GYN is retired? Mine did. So, okay, I mean, and people call me all the time, like, who can I go to? I'm like, I don't know anymore. There's so few, it's hard to get an appointment, but you can do telemedicine. That's a challenging pap smear, I'm just gonna tell you. Where am I? Oops, I'm going the wrong way. Here we go. So doctors are retiring early. Gosh, I'm predicting my slides. I must have given this talk before. OB/GYNs are leaving the state. I have some good friends who have left the state because of the new laws. And our residents, medical school, you do residencies, 4-year residency for OB/GYN. One of the requirements to complete that residency is to be able to perform abortion care. You have to know how to do a D&C, you have to know how to take care of these patients with the medications. And they're having to leave the state to get that education. And the UT system can't pay for that. So they're having to come up with the money. That's true. It's harder to recruit doctors to work in Tennessee, and I'm assuming you're walking over because my time's running out. Talk so much. So what can Tennessee do? We could expand Medicaid, although right now that might not work as well as it used to would have, but streamline access to, TennCare and Cover Kids. You guys know Cover Kids is a part of TennCare. All pregnant women in the state of Tennessee have access to Cover Kids, which is fantastic. I work with this not-for-profit, federally funded group of midwives who take care of people who are underfunded, people who don't have insurance, and they help them get this Cover Kids. It takes weeks and weeks and weeks and weeks and weeks and weeks and weeks to get that coverage. You don't fill out one part of your form correctly and you're delayed. So there's delays in access to care. If we could streamline Cover Kids, and I personally have talked to them and asked them to do this, just so you know, I'm not just preaching to you all, we could get people better care, sooner care, and more appropriate care. So improving access, you gotta have doctors, you gotta have midwives, you gotta have doulas. Paid family and sick leave, yeah, you all know that, I don't need to tell you that. And affordable childcare, good luck with that. Tell me if you figure that one out, please call me. And then the lethal fetal anomalies, and then rape and incest. You gotta be kidding me, dudes. I'm just throwing it at that. So this is what I always say. Just let me practice medicine the way I was trained to practice. And I'm gonna point out one other thing, again, not representing any hospital system. It's a Catholic hospital system. I am not performing abortion. I am taking care of patients who need care. So I'm here to ask you guys to help me to be able to do my job. And Dr. Grayson as well. So what can the next thing is what can you do? But and what can you do? You can vote. You can, I want to work on this. What can you do? You can talk to your legislators, you can educate others on voting mass, you can donate, you can stay engaged, you can vote. Questions?